Okay, welcome everybody to our um, review for test number 4. We'll be looking at Chapter 7 and Chapter 8, the Public Health Workforce and Public Health Administration. Um, so I'm going to be again, I'm not going to read through every one of these slides, but we will talk about the different public health workers and the workforce that's out there, the composition of the workforce, and they talk about some of the skill sets within the public health workforce. Um, Talk about some of the core functions, of course. It's difficult to define the public health workforce because it's kind of difficult to define public health. Technically speaking, trash removal is considered public health. Wastewater treatment is considered public health. It's really a nutritionist is a public health worker. It's kind of difficult to define who exactly the public health workforce is. So we'll talk about all the different enumerations or different nomenclature, I guess you could say, the different kind of terminology that they use. And the problem is that it's been a while since they've done a more recent enumeration or kind of definition of who the public health workforce is. And we'll talk about how it's kind of split up among the things. So the conventional wisdom is that the public health workforce is shrinking, but that's actually not true. The public health workforce is growing and it continues to grow. The average age of the public health worker is actually pretty high. It's 47. So, and a lot of these folks are going to be retiring. So it's a great field to get into now because the people that are working in the field are getting ready to retire. We're all old, so it's good for we need some new people, fresh blood in there. But also, public health is up and coming with the Affordable Care Act. There's a lot of public health initiatives under that legislation. So we're going to see, we should hopefully see a significant growth in public health in the future. Public health nurses we'll talk about. So as far as the full-time workers in government health agencies, we should take a look at this for a couple minutes. Um, First thing that you see is that, this goes back from 1995 to 2012, which is probably the most recent year that they did this. Um, you can see that, the state and the local, that's where most of the folks are really working. If you combine state and local full-time employees, it's, for 2012, it's 442,000, almost 443,000, and the federal level is 154,000. So the federal level, there certainly are a lot of workers, but it pales in comparison to what the state and the local levels do, or excuse me, have. And then another thing to take a look at is that, again, the total number of workers within, at least within the government, has increased. If you look at the total number, that column on the far right, excuse me, federal, state, and local full-time equivalent workers, from 1995 at 494 approximately thousand, 494,000, up until 2012, which is 596,000. So if you look at between 2008 and 2012, there was a 10,000 increase, excuse me, an increase of 10,000 workers. So that's almost that's about 2,000 work. I mean, it ebbs and flows. In 2008 it was 586, 586,000. Sorry, and then in 29 it was 583,000. Then it went back up again. So overall, the trend did go up. It went up about 10,000, which is approximately 2,000 a year, which is kind of good news. At least the government is kind of working there. So again, just more kind of slides to show you that the state and the local are really where the most of the workers are working, rather than at the federal level. Um, so again, what is this? So health agencies of local and state health government include the local health departments, the state health agencies, um, and then emergency medical services, mental health services, alcohol and drug abuse treatment. So all of these are considered in public health. Outpatient clinics, outpatient clinics, nurses that go out and visit, the food and sanitary inspections. That's something to consider. Some very important that the local community, or excuse me, the local health departments to get involved with. Animal control, pollution control. Again, I mentioned trash pickup. That could be considered in public health as well. Um, So very expansive field that we're talking about here, which is why it can be difficult to really define the entire public health population. So there's a couple slides here, and I think it's going to help us out with a couple different things. So first thing, if you look at this, ignore the first one, the administrative, because the administrators are always going to be, the where most of the workforce or a lot of the workforce is going to happen anyway. But we're going to talk about that in the next section in Chapter 8. That's more about the public health administration. But what I want to look at here is the registered nurses and environmental health workers. And if you look at that, those two combined, make up for almost half, 50% of the workforce approximately, compared to the rest of the folks there at the local health department. And you see the same if you go here, again, the administrative is 38,000, and then the registered nurses and the environmental health workers, between those, that's really the two most or the three most common work uh, titles that you'll see within public health. But it's really registered nurse and environmental health workers. Those are the two kind of more, other than the administrators, of course. Again, who should be counted? It's take your pick. I would say all these people should be counted, and that's just my opinion. But, again, who knows? I would say an administrative assistant working for a state, program, I would certainly say that it still has to count as a public health worker. So again, we're going to kind of talk about the workforce a little bit more. I'm going to skip over this because it's not really relevant. I shouldn't say it's not relevant, but at least not to our test. Public health workforce. So, as far as the training that the public health folks have to go through, generally master's degrees or doctoral degrees, PhDs, and then you can become there's a couple different certification processes for public health. It's always a good idea to get a certification if you're interested in working in the field. And if you look at the BLS, that stands for the Bureau of Labor Statistics. Very important when defining these occupational categories. So the BLS, the Bureau of Labor Statistics, is very, very important with regards to kind of setting the standards here for occupational categories. Or SOCs, Standard Occupational Categories. You see that all the time, especially within our tests. And then, of course, there's other public health agencies, too. We looked at that for discussion for week 2. I asked everybody to check out their local, state, or their state or local public health and give a description of it. And then human resources, of course, extremely important in public health, as it is in any area. As far as the salary for full-time workers, not bad, $50,000 a year. It depends on what type of work you're doing, of course. And what your degree is in, and whether you have a certification like a CPH or not. So, a lot of times public health work can almost be like social work in that way. So sometimes the salaries aren't comparable to some of the administrative salaries that we see. So some of the public health practice profiles, again, trying to prevent epidemics, responding to disasters, emergency response, assuring the quality of health services and accessibility of health services, developing policies and plans, trying to hook people together with the services that they really need, and evaluating effectiveness. That's what we're doing for our Final Health project, right? Looking at evaluating whether the programs or treatments or whatever are actually effective. So what's this one? Mean salary for positions in government health agencies. They do pretty well. The government health workers tend to have higher degrees, of course. So, getting a doctorate is certainly a great idea. I would certainly encourage it. You probably make more in private industry, but it's certainly a good idea to get it. And, working for the government industry, working for government is always a good idea as well. There's a lot of bureaucracy, of course, but it goes with any any large institution. Okay, so let's talk about public health administration. I'm going to skip ahead to a few of these because I want to talk about the administration, public health administrators. So think about if you work in a clinical setting or any place. I worked in the pharmaceutical industry. I worked in processing. We actually made the vaccines. So the administrators tended to be the ones that were not actually on the floor doing the work. They tended to be in their office doing other things. So these aren't, when you're talking about public health administrators, it's probably the same thing in your hospital if you work in a hospital. You're out on the floor working with patients while the administrators are kind of, in suits and ties and doing, more important things. I'm kidding, obviously. But they're not actually working with the people. They're kind of working behind the scenes. And once you actually get behind the scenes and realize what these folks are doing, you realize why they're making so much money because it's really a lot of work. Policy and plan development, again, linking people with needed services, doing that, evaluating effectiveness and things like that. So developing all these plans, and there's so much work behind the scenes that gets done by these public health administrators. They're not the people that are actually out diagnosing illnesses within people. They're not out there like the nurses, doing blood pressure examinations with the public. They're working more behind the scenes in their offices, whatever doing whatever administrators do. They kind of keep us in the dark while they do their own thing, right? So that's why they make a lot more money than we do. We're thinking again more higher up within the chain of command. And again, they're higher up. They have a kind of a broader view than what some of us that are a little bit more on the ground might have. But they're certainly doing pretty well for themselves. So as far as government, so full-time positions right now within government, a little over 25,000. By 2022, it doesn't look like it's going to grow a whole lot. I don't see that growing a whole lot. So this one, so social and community services managers, full-time positions within government health agencies. So right now there's about 24,000. It's expected to go up to about 26,000, so about a 2,000 increase. So that's not too bad. And they do pretty well. 70 grand a year. I would take that certainly. Um, Emergency management directors. Again, not a whole lot out there, but again, certainly in a very important role. Should probably make a little bit more money, in my opinion. In my opinion, everybody should make a little bit more money, including me, of course. And I think that was pretty much it. So I was trying to get as many of the test questions as possible. Hopefully, this was helpful. Take care.